Knock, knock, knock.
Come in.
Hi. Hello, Miss Thames. How are you doing today?
I'm good, thank you.
Good. I'm Isaiah. I'm your student nurse. May I please see your wristband?
Yeah, of course.
And can you please tell me your name and your date of birth?
Cynthia Glenn Thames, 12/27/1963.
Okay. I'm gonna wash my hands.
Okay,
Give us some privacy.
okay.
So we already got your pulse, which was at 80
Uh-huh.
BPM. We got your blood pressure, which was 120/80.
Okay.
Everything's looking good. I'm just gonna look at our doctor's orders and see what else we have to get done. So the first thing that I'm going to do is, if you could just look at me, we're just gonna make sure your face is symmetrical, which it is. How are you feeling today?
I'm good, thank you.
You good? Awesome. Another thing I'm gonna do is I am going to just look at your ears. Could you move your hair? We're just gonna look, make
Yeah.
sure they are symmetrical.
I have big ears.
Oh, that's okay. Other one. So everything is symmetrical. Have you ever had any issues with hearing
No.
at all?
No.
Good. So for your eyes, I am going to look at your pupils. So there's gonna be a little bit bright, okay?
Okay.
All right. Awesome. So your pupils dilate perfectly fine. Can you follow the pen for me? Looks good to me. Now, have you ever had any issues with seeing? Do you wear glasses at all?
I do.
You do wear
I do.
glasses?
Yeah, I have on contacts right now.
Okay. Cool. But you can see me perfectly fine?
Yep.
So, can you lift up your head for me? I'm just gonna look at your nose, nostrils. Cool. They look symmetrical to me. Have you ever had any issues with smelling?
Mm-mm. No.
Awesome.
I get a sense of smell.
Now, I want you to just open your mouth and go, ah.
Ah.
Okay.
Ah.
Okay, cool. Everything looks good. Now, just move your neck to the side, to the other side. That looks good to me too. Alright, do you have any issues with taste, or have you had any oral pain or anything like that?
No.
Awesome.
I have no pain, zero pain today.
Okay, I love to hear it. Now we're gonna look at your consciousness and your orientation. Can you tell me what year it is?
It is 2025.
Do you know who the president is?
Yes.
Who is?
Trump.
Okay, Donald Trump.
Yes.
And that looks okay to me. Everything sounds good. So next thing we are going to do is I am going to check your pulses.
Okay.
Is that gonna be okay with you?
Yeah.
Awesome. So first thing, we're doing the atrial pulse,
Okay.
so which is right here.
Okay.
Pulmonary, Herb's point, tricuspid. Can you lift up your breast for me? And mitral. Okay, good Lord. Everything sounds good. Now I am going to do the respiratory.
Okay.
So right upper lobe, left upper lobe. You lift up your breast right here. Right middle lobe. Now lift this one up for me. Left lower lobe. All right. If you could turn on your side, and I want you to put your arm like that. We're doing right lower lobe. All right, turn on your other side. And one more time with your arm. Left lower lobe. All right, lower. And just breathe in and out for me. Left upper lobe. Right upper lobe. Left lower lobe. And right lower sounds good so far. Just checking out doctor's orders. So before I do the musculoskeletal, can I please see your wrists? We are just going to just flip them over for me. Checking your pulse rate. I see your other wrist. Checking your pulse rate. So looking for the pulse right here. Yeah. So I just did the radial pulses and the brachial pulses. We're looking for edema. No edema. And for edema, no edema. Could you please take off your shoes for me? And I'm gonna look for the pulse over here. This is a dorsalis pedis pulse. And this is the posterior tibial pulse. Okay, I'm gonna see this. Dorsalis pedis and posterior tibia. Edema. One more time. Okay, so everything looks good. Thank you, Ms. Sims.
You're welcome.
Alright, so we are going to do range of motion on two upper extremities. So I just want you to lay your hands out like this.
Okay.
And we're gonna lift it up. That's hyperextension.
Uh-huh.
Then go back here. That's extension. And then go like here. That is inflection.
Okay.
And I want you to do the same thing. So hyperextension, extension, and inflection. Okay, everything looks good. Now I want you to try to use your strength and like lift my hand up. Okay? Now we're gonna do the same thing. Alright? So lift. Alright, now go again. Awesome. So with your feet, I want you to, you're gonna stretch it like this, like go downward, that is a plantar flexion. Upward, that is dorsal flexion. Same thing, plantar flexion, then dorsal flexion. And then do a strength again. And go down. Okay, strength again. Go down.
You're strong, Isaiah.
Good, well, I appreciate that. Now, can you please, if you want to put your shoes on, you can. But put your shoes on, and then.
Sorry.
No, that's okay.
Slow. Okay.
Now, if you could just stand up for me and do this. Yeah, cool. Now just walk towards me, and then I'll walk back. And then you can sit back down. And have you had any issues with walking?
No.
Anything like that? Do you use a cane at all?
No, I don't.
Okay. And have you ever had a history of falling?
I have in the past, but not recently.
Okay. Awesome. Well, everything looks good to me. Are you feeling okay?
I am, yes.
Feeling good?
Yes.
And we'll have your care team come talk to you as soon as they can, okay?
Okay, thank you.
Thank you, Ms. Sims. You have a great day.
You too.